Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. We start today with chapter number 17, communication with a client with communication disabilities. So the concentration here will be in the disabilities and how we can, as a health professional, deal with those people and communicate with them. The objective that we will cover for this session, the first objective, we will identify the common communication deficit like hearing loss, vision loss, speech and language deficit. Then describe the nursing strategies for communicating with a client with communication deficit, with hearing loss, vision loss and speech and language deficit. Discuss the appropriate or the application of research finding in your clinical practice. So those are the three objectives that we will cover in this session. First, we will start with the basic concept of the communication disability. A client with communication deficit, we can say that any client who has any impaired in body structure or function that interfere with the communication, he will be included in the communication or in the under this category. So what do we need for communication in order to communicate well? What's the thing which is needed as a normal person? What do we need to communicate? We need mostly, it is the senses. So in order to communicate, I have to be able to talk. So it is the ability of talking. So the verbal messages, it has to be said to others. Also, I have to see the concept in order to translate it, and then in order to conceptualize that whatever I see. So vision also is needed for communication. I have to hear. I have to hear the sound. I have to hear what the other are saying in order to be able to communicate with them. So all the senses, also even smelling, because the communication also it interferes with the smell, while we are not discussing it in the session. So there are all the senses are included in the communication. So any defect in any of those senses, it will affect our communication process. Even the mobility, it will affect our communication, because we have to move, we have to do the language, the non-verbal communication. Also, it will help the verbal communication in order to understand the context in a proper way. So, studies showed that the nerves are that when the nerves are unable to understand the client with communication and disability, in this case, what will happen to the client? The client, either if when we are cannot understand, he is trying to give something or ask for something or for a favor or for care, but we cannot understand him. In this case, he will be frustrated. He will be angry because we cannot understand him. So, or he might be depressed, or it might be uncertain. Some client, in this case, they will omit their need because no one will be able to understand him. So instead of just trying to explain, he will omit that, and he will not try to ask for that help or that needed care. The barrier is that the client deficit and the staff negative attitude sometimes or failure to adapt to communication. So it will also interfere with, it might be a barrier for communication when there is a client deficit, when the client is having deficit with then the ability of communication, and the staff also have negative attitude or fail to adapt to the communication and unable to find a way to communicate properly or to try to communicate with this client. So again, the barrier in this case that if we have a client with communication deficit and in the other hand the staff is having negative attitude toward him or toward adoption of a way of communicating with proper way of communicating with that client. So always we have to find out a way of communication with our client if he is having any kind of problem that interfere with his sensation and ability to understand or to express himself. The common communication deficit that might be there is hearing loss. So hearing loss, there are kinds of hearing loss. Either it is conductive hearing, so the the vibration that is arise from our sound of it has to go to our from external ear to the internal ear until it reaches the cochlea and it will be transferred to the nerve. So if any defect is there in the ear, either the outside ear or the ear canal or the bony ossicles or the internal ear, in this case, it is the patient or the client will not be able to hear properly the message. Even wax, if the ear is impacted with wax, it will decrease the ability of hearing process. The second thing, which is sensorial or sensory neural or sensory defect, which happened after the inner ear damage to the auditory nerve or the inner ear and the cochlea. There is functional hearing loss that cannot be explained by organ cause. It is functional. It might be related to psychological problems and other factors. So those are one of the factors is hearing, or one of the common cause of communication deficit is hearing problem. Then blindness. Then speech and language deficit. Mental disorder also, in case of patients who are having schizophrenia, patient alternation in neurotransmitter that interfere with the responses to others. Those who are having also language deficit due to many causes, due to either developmental problem or delayed development. Intensive care unit also related factors. Though the patient when he is in the intensive care unit, due to the disease that he is having, due to the machine that we are using to help him in survival, also all of that, it might interfere with the ability of the client to communicate. Our primary nursing goal is, so the primary nursing goal in order to help them here is to maximize our client ability to successfully interact with the care system. So the main goal here is to maximize the client ability to successfully interact with the care system or with the healthcare professionals when they are taking care of. So when we are going to the first problem, which is the hearing loss. In hearing loss, if we are taking it in children, nearly around 3 of every 1,000 newborn are deaf or having a kind of hearing loss. Because of that, it is a very important thing to discover those problems as early as possible. Because if it is discovered early, there are some problems that we can overcome them and we can help the small infant in dealing with this problem. Many of these deficits are diagnosed at birth. Newborn hearing is tested in the nursery via auditory brain stem responses test. So there is screening test that they will do audiometry for the children in order to see their ability to hear. Hearing screening is recommended for all newborn children as a preventive services. So as a preventive healthcare measure in order to prevent the further complication. So in children, if they are unable to hear, then in this case they will be mute. They will not be able also to speak. In older adult, as we are getting old, all the body mechanism, all the body function also will be affected by aging. And from that also the hearing, it will be affected, or the ability to hearing loss, it might be there. So older adult, as we get age, we have increased likelihood to have a problem with hearing or degeneration of hearing structure, which is sensorial dysfunctional that normally occur with aging process. Also, it is not only aging, also according to the work that we are doing, if we are working in an area that there are high pitch or high sound is there. In this case, also the high frequency sound, it might affect our internal ear, and also it will affect our communication. Because of that, we have those who are working in any area that has explosion or a high sound, like the airport and the machine, those who are working with machine that produce a high sound, they have to use a protective measure and in order to avoid the hearing loss. British studies found that older adults, especially older than 75% years, have either significant decrease in hearing or poorer concentration or discrimination or change in their also conversational style due to those changes. So about the speech, and so that was the hearing loss and type of hearing loss. Now we will come to another side, which is the speaking and language deficit, ability to speak. Ability to speak, how we can communicate without being able to speak. And there are many things that might cause, which is aphasia. Aphasia, it means that there is a neurological linguistical deficit is there. Either it might be global aphasia, which is difficulty in receiving and understanding the expressions. So it might be after head injury, or it might be after certain diseases. Also, expressing aphasia in this case he can understand, but he cannot express himself. So he can understand what you are talking to him, but he cannot express himself. Receptive aphasia, difficulty in reception and processing written and oral message. Difficulty in understanding what we are talking and what's the message that we are conveying to client. Client unable to speak even temporarily sometimes because of interference or health care that we are providing for that client, like insecure feeling of or frustration in cases of when we are feeling anxious, when we have fear. In this case, we will face difficulty in expressing ourselves and expressing what is going on. In the hospital also, if the patient is on intubation, how he will express himself properly, or the ventilator, they are using ventilator, even when the patient is in need for having mask, oxygen mask, this also will affect in a way the ability of the client to communicate. So the procedure itself, the medical and nursing procedure that we are using, sometimes it will affect the ability of the patient in communication. Even the medication that he is taking, because some of the medication that might reduce sleep, some of the medication that might lead to some confusion or that interfere with the ability of consciousness of the patient. In this case also, will be a difficulty in speech or in transferring his message. Specific tips for a client with aphasia. If we are having a client with aphasia, in this case we have to speak in a short and a clear sentence, very short and clear sentence, in order not to, and it has to be simple also, in order to let the patient or the client understand it properly. Use non-technical term where is it possible. So technical term should not be used. If the patient is able to read, write down keyword on a piece of paper as you are speaking. So you can speak and also write for him if he is able to read. If it is appropriate also, we have to demonstrate what you are saying using gesture also and sign language, using sometimes picture for him, using that illustration or some props. So as we can, we have to simplify what the thing or the message that we have to transfer to this client, and use as we can of visual aids if we have anything that it can help the client to understand. Ask a question requiring also mostly yes or no answer. So simplify your question and try to use the question mostly which is of yes or no answer in order to be more consistent. Ask if the client could use any alternative method to back up their speech. So we will see if there is any alternative method that it help the client in regaining his ability to speak. Any device that can be used which can help the client for speaking. What's the nursing what if the nurses are unable to understand those clients? If the client, we said it before in the previous slide, if the nurse is unable to understand the client, in this case, studies shows that this will lead to frustration from the side of the client and angry, anxiety, or depression, or omitting the need for care and being isolated and not requisiting any need, because he will face difficulty in expressing himself and explaining what does he need. Instead of that, he will not ask. He will keep silent and he will not talk. About legal aspect here, legally we should not discriminate between people who are able to communicate and the other people. So legally it is prohibited to discriminate on the basis of the disability, if the patient is having disability, or if the or national or origin or religion or whatever the other causes. So discrimination it should not be there, and we have to deal with those people as they need, not because of they are having some disabilities. Suggestion that we will come here to the suggestion that for helping the client with sensory loss, if the patient is having sensory loss, always here we have to maximize the use of sensory aids. Like if he is losing or difficulty in there's any proper vision, we can use the eyeglasses. We can help the client with wearing the eyeglasses, the proper glass to keep the eyeglass clean. So if he is using, if he is having difficulty in hearing, we have to be sure that there is a hearing aids that he can use it, and it is properly adjusted in its place, and the battery also is in a good level. All of those things we have to be sure of it in order to help the client to communicate properly, or to maximize the patient ability to communicate. So always maximize the use of sensory aids such as hearing aids, picture, sign language, also to use sign language, regular or laser can which vibrate or warning and obstacle within 5 feet. So we can use those things for those blind patients sometimes. Pick the mean of available communication best suited for your client. Choose the proper device that it is needed for your client. Help our elderly client to adjust to hearing aids because they are having sometimes difficulty in doing the or in manual dexterity and using those dexterity thing and very small thing to adjust it. So the elderly client may be unable to insert this aid or the amplifier or adjust it and put it in his ear. For hearing impaired client, when we communicate with a client with hearing deficit, always we have to stand in front of him. Why we have to stand in front of him? Because most of them, they develop the ability of reading the lips. So when we stand in front of them, they can read our lips, and they can understand also our sign language or non-verbal communication that is accompanied with our verbal communication. So stand or sit so that the face of the client and the client are seeing your facial expression and mouthing of words or the lips movement. Communicate in a well-lighted room also, because mostly old people also, it is not only impairment of hearing, they might have some impairment also of vision. So the room, it should be well lighted. Use facial expression and gesture that reinforce the verbal context. So concentrate also more in the non-verbal communication along with the verbal communication, and being in front of the patient is in order to let him read your lips. Speak distinctly without exaggerating the word. So speak a normal speak. Partially deaf client respond best to a well-articulated word spoken in a moderate or even even tone. So don't, because as we said, they are concentrating more on lip reading, and when we are trying to moderate our way of talking, in this case, sometimes it will interfere with the movement of the lips. Write important ideas. So you can write an important ideas and allow the client the same option to increase the chance of communication. So we can write for him and let him write for us, or he can speak. Always have written pad available. So we have to have a written pad to write for our client or the computer. Always face the client when communicating so the client can see your lips movement, as we said. Tap on the floor or the table to get the client attention via vibration. So when we tap on the table, the vibration will form, and this will attract our client. For hearing also impairment client, amplify telephone handset. It has to be amplified for the client with partially hearing loss. It has to be raised, the voice of the telephone set. If unable to hear, rely primarily on a visual material. So use the visual material for him. So arrange for close captured television, so we can use television for him, so we can see the television. Use text messaging on client's cell phone or email at his or her computer. So the message, instead of talking to him directly, we can send, it might be the text, either text or WhatsApp or whatever we can, the program that he is using, so we can send him messages, written messages, rather than talking, or both of them at the same time, talking and messaging. Encourage the client with hearing loss to verbalize speech, even if the person using only a few words. So just to try to speak, especially if he's having difficulty in speaking, or the words are difficult to understand at first. Even if the patient is having difficulty to produce the sound that it can be understood. Use an intermediary such as family members. So we can use a family member who know the sign language to facilitate communication with deaf client who sign. That you are assigned to. So if you don't know how to use the sign language, you can get a help from the family member or anyone that who can translate your word to a sign language. And sometimes we have sometimes the pads or the computer that can translate the vocal messages to a sign language. It can be used for those clients. About vision loss, so in case of vision loss, a human really had having vision loss for they are depending heavily, they are depending mostly in vision also in the communication. Loss of vision, it will mean that loss of non-verbal cues. So the patient cannot see the non-verbal cues accompanied the speech of communication. So clients who lack vision loss primary method of decoding messages such as facial expression. You will not see the facial expression, nodding of the head, and leaning toward the client. So if you are leaning or not leaning, you will not feel that. So for vision impairment client, how we can deal with him or help him to understand the message? Let the person know when you are approaching by simply touching the client, and always indicate when you are leaving. So and also you can get the permission from the client before entering his room or his site by getting permission before and try to talk to him before reaching him, then you can go with it. Adopt teaching for a low vision by using large print. If the patient can see but he cannot see properly, or there is limitation of vision, in this case we can use large print and audio taped information, or we can use Braille method if he is able to read the Braille method, or he learn how to use the Braille method. And there are some also kind of computer that you enter the message and send it to him, and he will read it by, it will be changed to Braille method, and he can read it. Do not lead or hold the client arm when walking. Instead of that, allow the person to take your arm not to hold his hand and try to help him in walking. Let him hold your hand instead of that. He will feel more easy. Use touch and close physical proximity while you are with the client, and give the person something substantial to touch in your absence when you are not there. So give him something that it will help him to see that something is there around him. Develop and use a signal to indicate change in pace or direction while walking. So let him also know what is going on in front of him. So when we are helping him to walk, we will let him to hold our hand, and we will tell him, just now we are reaching the door, so we will open the door and go out. There are 3 steps that we have to go down. So he will make a map in his mind what is going on and what he has to do. Now we are going to turn to the left side. Now we are going to turn to the right side. Now the tree is in front of us. Now we are going to cross the street. So we have to give indicator what we are going to do. Orientation, environmental hazard for a client with impaired vision also. We should orient the environment for a blind client when he is introduced to a new environment. So whenever the client is in a new environment, we have to make him aware of that environment. Describe the room size that he is in, position of equipment in front of him and around him, placing their food tray, and also we are using a clockwise while we are arranging the food in order to let the client understand what is their an arrangement of this dish. So using a clock space and lodge or clockwise. If there is unnecessary equipment in the patient room, it's better to remove it in order to keep a space for the client to move without any hazards. Tell the person who came to client to introduce themselves also when they are coming. And also when you are entering the client room or zone, in this case, you have to introduce yourself, like, I am your nurse, I am so, my name is so and so, and I want to, what I want to do. Blind client need guidance in moving to preserve the client autonomy. Some of the client, they are able to they develop the sense of using other senses more, in which is hearing and touch, in order to help him to deal with the environment and to and we see them moving as if they are not a blind person. Offer your arm, as we said, instead of taking the client arm. Mention steps and changes in movement to help the client and to navigate a new places. So we have to describe what is going on, as we said before. Now, strategies to communicate with the client in the intensive care unit. If our client is at the intensive care unit, here the intensive care unit it is different in this case, and it will depend upon the client case. We have to encourage the client to display picture or simple object from home. Orient the client to the environment, even if we cannot see what's there, so we can describe where is he and what is going around him. Frequently provide information about the client condition and the progress. Also, we have to tell him about his progress and the improvement. Reassure the client that cognitive and psychological disturbance are common during this period, and later it will those problems can be solved gradually. Give explanation before any procedure, even if the patient of your client is unconscious, completely unconscious. He may still be able to hear you because they found that hearing is the last senses that it can be lost. So, and many patients who were unconscious, they were telling the nurses what they were saying during where they were talking about while they are beside them or where they are taking care of them. So give explanation before procedure by providing information about the sound and sight and the feeling the client is expressing. Provide the client with frequent orientation cue to time and place, because in most intensive care unit it is closed, closed unit, always it is lighted, so they cannot discriminate between daytime and nighttime. So in this case we have to remind them and reorient them to the timing and date. Strategies to assist the client with speech and language deficit. If the patient is having speech and language deficit, avoid prolonged conversation. Instead, use frequent short talks and present a small amount of information at the time. When a client felt in a written or oral expression, supply needed compensatory support for him if he is able to reply. Price effort of communication, so you can price your patient that he is doing well and we can understand him properly. Provide regular mental stimulation in non-taxing way. Also help the client to focus on the factualities and the facts still available to them for communication. So the other senses that the patient is having, we have to concentrate them and empower them and let the patient use them more in the process of communication. Allow extra time for delay in cognitive ability processing for information. So if the patient is having delay in understanding, in this case, allow him, give him a time, use a simple language, don't rush in dealing with it. This client always use simple language and short sentence. For a print material, use a short also and bulletin list. So it has to be a short text point. Vision, there is a vision enhancement equipment that can be used. So in the patient who is having impaired vision, we can use electronic magnifier machine that can magnify and increase the font of writing. Auditory teaching material such as on an audio cassette. Also computer screen reader with a voice synthesizer. Braille keyboard we can use for them. The Braille adapter card or letter, both print and braille. So both nurse and client are understand. So it can change from printing, normal printing from the nurse to Braille and translate the Braille to normal printing to the nurse. The TeleTouch, which is a portable machine into which the nurse type the message that emerge in the Braille on the punched out paper in Braille form. Large print material, if the patient can having impairment of vision but he can see at least. Voice synthesizer available in a wide variety of household applications such as talking skills. So that it is built in within the thing that the patient is using. telemicroscope, handheld telescope that can be used with the client. Video magnifying machine also that might increase the size of the video. Enhance lighting and light filter that reduce the glaring and enhance the contrast of the content, that it can be easy for them. So those are some of the vision enhancement equipment. This is the Braille keyboard. Or there are also those dots that can be used by the client. The computer screen reader with voice synthesizer. The touch portable machine in which the nurse here type the message that emerge in a Braille and punch out with a paper in a Braille format. So normal printing, we are printing, normal printing, but it will be changed by this machine to Braille typing, and it will go to the patient. This is the telemicroscope that is a lens which is attached to the eyeglasses of the client, and it will magnify what he is seeing. Electric magnifying machine also, the pad or the screen, it will magnify the thing that when he is starting to show it, it will magnify it and increase the font and the size of it. Video magnifying machine that he can concentrate in the part and he can see. So all of those devices can be used with those patients who are having vision disorder. Situational factors also that affect the client responses to hospital critical care. So in that situation, the patient, if he is anxious or fear or having fear, this will interfere with the client ability to communicate. So always, if we feel that the patient is anxious, we have to evaluate him, assess his anxiety, why he is anxious. Mostly anxiety, it came from lack of knowledge. So we have to see what kind of knowledge that he is lacking, and we have to explain it to them. It might be even for some people, even entering the hospital or the clinic, it is a kind of anxiety for them, because they might feel that it is while they are coming here, the problem is a huge problem. Because of that, they brought him to the hospital or to the clinic. So it will increase the level of anxiety and the level of fear. If the patient is having pain also, this interferes with the ability of the patient to communicate. Altered stimuli, too much or too little, including unusual noise and isolation. Unusual noise, the machinery that we are using it, the noise which is coming, or the voice which is coming from the monitor that we are using, the noise which is coming from the suction machine. So it is a unfamiliar thing for the client. So it might be reducing some anxiety for him. Or being isolated, in case if he is in need for being isolated, either to protect him or to protect others from his illness that he is having. Sleeping deprivation. It is common in hospital because of, especially in wards that might have 6 patients or more, and everyone is having different kind of need. Everyone some time one patient will be in pain and he is complaining, the other want to sleep. So all of those things will interfere with the ability of communication and taking rest. Because of that, we have to categorize also the patient in the rooms according to that, in order to avoid it is not a discrimination, but in order to avoid disturbance of the patient. Unmet physiological needs such as thirst. The patient, sometimes they are fasting due to preparation for operation or preparation for procedure. So it will lead also to disability of communication. Losing track of time. If you don't know the time, is it morning, is it evening, is it Sunday, or is it Friday? So also this the time and the recognition of time, it might be there because of hospitalization, and if it is, especially if it is for a long period of time. Multiple life changes and able to multiple life. He is how he is eating, way of eating, type of food that he is eating by nasogastric tube. Is there oxygen in use? Is there any cost? So all of this it will lead to change of the life of the client. Multiple care provider. You know that the health worker, they are working in 3 shifts, and every 8 hours he is seeing different kind of people in caring for him. Immobility. If the patient is unable to go out of bed, also this is leading to frustration and inability to communicate properly. Frequent diagnostic procedure. Every now and then they are coming to take blood sample from the client to do different kind of tests, doing X-ray, doing ultrasound. So all of those diagnostic procedures to increase the anxiety of the client if we are not explaining for him the use of that and why and what's the result. Lack of easily understood information. If we are not give him an easily understandable information, in this case also, it will lead to more problems. So, in conclusion, all workers who come in contact with a client need to be aware of, they are in need to be aware of their communicational environment. So, when we are taking care of any client, we have to evaluate and see if he is having any impairment in communication. We need to learn how to operate and fit equipment, because hospitalized client often need help with those devices that is used to help them to communicate properly. So we have to be familiar how those equipment are used and how we can help the client to use them in a proper way. Our skills also in adapting communication is an important for a client. So we have to be skillful enough to adapt the patient, to adapt with the client also in the process of communication according to his need and according to the disability of communication that he is having. Thank you.